Welcome to a very special episode of Sparkling today. My name is Intias Kiran with my partner.
Aurin Kirana Putri Barlianta.
So, today, we're thrilled to bring you an inspiring knowledge today. So, today we have an incredible guest, Mr. Rizky Amanullah,
Halo.
a lecturer and study program developer at Poltekkes Kemenkes Yogyakarta. And today, Mr. Rizky has just completed the prestigious Thematic Short Term Training Scholarship, or TSTTS, in Public Health Management. It's fully funded by the New Zealand government and delivered by the University of Auckland. So, for the next 30 minutes, we will dive deep into the world of global public health, exploring the lessons, experience, and key insight from this exciting program.
Thank you, Intias. Mr. Rizky, it's
Yeah.
such a pleasure to have you here. But before we dive deeper, could you please tell us how did you get the opportunity to join that program?
All right. Thank you, Aurin. It's my pleasure to be here because, with you all. Actually, I'm a lecturer of Poltekkes Kemenkes Yogyakarta, specializing in public health and also health law. Uh, Throwback in early 2025, I received information about TSTTS scholarship offered by New Zealand government by our HR department. The program is part of the Manaki New Zealand Scholarship, aimed at strengthening health system and healthy public policy in participants' home countries. Especially for my segment is from ASEAN countries.
Mm-hmm.
The scholarship focuses on supporting health professionals to lead strategically, promote governance ethics and transparency, and also support the development of effective and also inclusive system of local and also national governance.
That's remarkable. Could you please share with us what motivated you to apply to the program?
Yes, I've always believed that public health is about more than treating illness. It's about preventing disease, prolonging life, and promoting health through the organized efforts of the society. This program offered an opportunity to learn more from a New Zealand perspective and also experience, particularly in building resilient health and addressing health inequities. It was a chance that I couldn't pass up. So I wouldn't miss these opportunities.
Yeah, that's interesting. So interesting. Okay, so let's get into the content of the program. Like, who were the organizers and what topics did you cover?
Okay, good question. The program was organized by the Public Policy Institute at University of Auckland, New Zealand, and also collaborated with Wellington University of New Zealand under the Manaki New Zealand Scholarship Framework. It ran from October 20 to November 21st, 2025. The course covered a wide range of topics, including introduction of public health and public health management, understanding what public health is, the science and art preventing disease, prolonging life, and also promoting health through the organized efforts of society, and also understanding about ethics and equity. Public health ethics focuses on community level benefit, social justice, and also health equity, not just individual autonomy. And then social determinants on health. Factors like housing, I understand about housing too, about the roof also, income, employment, education, and social connectedness shape health that far more than healthcare alone. And then evidence-based decision making. It's really help us to make some decision related to public health sectors and also in our management sectors, using the best available research to inform public health policy and programs, and also health promotions. We got a lot of range of health promotions guided by the Ottawa Charter, which outline five key action areas: building healthy public policies, creating supportive environments, strengthening community actions, developing personal skills, and also reorienting health service. And also we also studied some poster came from Asian countries uh, Asian countries, especially Indonesia and also Thailand, are so creative making health campaigns. Yeah, and also their advertisement. When you see Thailand advertisement, they are very very funny, but
Yeah, that's right. That's right.
but got a lot of punchline and got a catchy message about healthcare itself. Yeah, we should learn more about uh, the campaign from the Thailand
Right.
actually. And also we learn about vaccination and also addressing vaccine hesitancy, understanding why people hesitate to vaccinate, or maybe make some immunization for the kids, and also back at the COVID-19 case, yeah, why they hesitate to make some vaccinations back in the day, and also how to build trust and also confidence in immunizations. And then we also learn about communication in public health, also AI, and also digital health. We learn about how to use AI, the history behind AI, and etc. And also uh, in a lot of European countries, uh, because our professor back was from Oxford University.
Mm.
Uh, the AI developed in there is for medical records
Oh,
purpose.
I
Yeah.
see.
So we just record our voice in there, and then the AI transcripted the text, and also we also record our video for for the patient service and etc.
Mm-hmm.
So there will be uh, what is that? Zero margin of mistakes about the medical records.
Mm-hmm.
And then we also learn about global health challenges, including climate change, double burden of disease, health workforce shortage, and also concept of permacrisis. Permacrisis concept.
Mm-hmm.
Permacrisis is one of popular word back in the day, 2021. Maybe you can search the term about permacrisis,
Mm-hmm.
and we should study a lot of things about permacrisis. We can make some research about that. And then public health management in disaster and crisis. I also shared some point of view about our Merapi disaster back
Mm-hmm.
in the day, 2006 and also 2010.
Mm-hmm.
How we manage the disaster, and then risk communication, health system resilience, and also with the frameworks and also theories from STAR and ECHO,
That's
things like that.
okay. That's incredibly comprehensive curriculum. What module stood out the most for you?
For me, the sessions of strengthening community actions and health system resilience were particularly powerful. I learned that community empowerment is at the heart of health promotions. When communities own their health issues and solutions, real change happens. For example, what we practice here in Poltekkes Menkes Yogyakarta is about uh, waste bank and trash bank.
Mm-hmm.
uh, Nowadays we are really concerned about the trash management in Yogyakarta and
Yeah.
also in Indonesia.
Mm-hmm.
It's very very poor management, and I also shared their point of view, and they got really surprised because uh, in a lot of countries they also made some good waste management in there, especially in European or in New Zealand also. But in most of Asian countries like Indonesia, Myanmar, uh, Thailand also, we got some poor waste management.
Mm-hmm.
Vietnam also. So, but Singapore is different. Singapore is like very very strict, yeah, for the waste management.
Mm-hmm.
Uh, uh, we face the challenge that a lot of people can throw away the trash everywhere at the streets and nearby their homes, and burn the trash everywhere, and it's really made a worse impact on the environment. So the best practice that we did that with trash management and with the recycling village like in Sukunan managed by our director,
Mm-hmm.
I share about that. So wow, it's a good movement actually. Can it can make a difference in Yogyakarta and also in Indonesia. We also got the founding fathers of Waste Bank. Uh, Mr. Dr. Babang Suwerda.
Mhm.
So I already shared that too. They Whoa, why Indonesia didn't apply that kind of movement
Mhm.
nationwide? Yeah,
Yeah.
because yeah, actually we got a different what is that priorities, especially in politics too.
Mhm.
It's about MBG right now. Yeah, actually we got the threat about the trash also. We should make attention about the trash also.
Yeah.
Yes, that's right. So I want to know about the what was the most memorable experience during the training?
Yeah, actually there were so many of them. First, the cross country interaction. We had participants from across Asian like Indonesia, Vietnam, Thailand, Myanmar, Philippines, Malaysia also, Singapore also. Sharing perspective on health challenges in different contexts was eye-opening. Also, we also got some participants from Indonesia, not only from government organization like us, Ministry of Health, Public Health Center, and also from NGO. We got one participant from NGO also.
Mm.
Oh wow.
Uh, the other participants come from Public Health Center,
Mhm.
uh, and also hospital, and also Poltekkes also, the other Poltekkes
Yep.
from Bengkulu,
Mhm.
one participant. And I also got some contact with them and manage some WhatsApp group. We still got the communication through the WhatsApp group and through the learning management system
Mhm.
called Canvas. Second, I was deeply moved by the concept Manakitanga.
Wow.
Manakitanga is a Maori. In New Zealand, we use Maori language
Oh.
Oh,
like Kia ora, hello, Kia
oh,
ora,
Oh.
Tenako, thank you, yeah. Manakitanga is a very value meaning like hospitality,
Mhm.
generosity, and mutual respect. It's almost the same with what we believe in Yogyakarta.
Mhm.
Yeah, it reminds us that caring for others is central to public health and public service. Yeah. Third, the classes were highly interactive. We had a lot of case studies back in the class, so everyone should participate actively,
Mhm.
and also small group discussions divided by a breakout room for maybe 1 or 2 minutes only. We discuss something and we bring the topic to the big audience,
Mm.
and then also practical exercises. We also got some homework to do and also
Oh.
exercises for that. We should collect the homework precisely.
Mm.
For
oh,
example, we analyze how New Zealand responded to meningococal disease outbreak, uh, and by addressing the housing overcrowding, and also a classic upstream public health intervention in there.
Okay, that's interesting. I believe that besides all the positive experiences, I believe there must be something challenging for you too. Could you please share with us what's the most challenging part for you during that
Yeah,
program?
yeah, a lot of challenge that I face. The online format made us actually more flexible during the our work days and etc.
Mm-hmm.
During the course, I also managed a lot of things in my office too, international service office, partnership, and also managing some lecturing in some classes. Yeah,
Mm-hmm.
managing time
Yeah.
is quite hard, and also we 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 do the Zoom meeting across different time zones.
Mm-hmm.
yeah.
Uh, we do this Zoom meeting maybe in New Zealand at it's about at 2 p.m. in there, and in here is in the morning, still in the morning.
Mm-hmm.
Mm.
So we s- we also should stay engaged in the virtual discussion while we are managing a lot of things in our office.
Mm-hmm.
That's hard things to do too, and also completing the assignments, a lot of assignments while maintaining our regular work. So the main challenges here is how to make a good time management in here. So the support from organizers and the sense of community among participants actually help us to make it more manageable. They understand that we are also busy doing a lot of things. So yeah, we should say if we have some troubles doing some homework, join the meeting, we should say about it, and it's okay for them.
All right, so before you mention the health system resilience, so can you please explain us to what does it mean?
Okay, absolutely. I'm not the expert, but I will share about my learnings back in the day at the course. So health system resilience is ability to prepare for and respond to, and then maintain core functions during and adapt after health crisis. We learned back in the day the COVID-19 pandemic taught us that even well-resourced health system can be overwhelmed back in the day.
Mm-hmm.
Resilience means building flexible systems that can absorb shocks and recover quickly. WHO defines six building blocks of a health system. The first one is service delivery. Second one is health workforce. The third one is health information system, and then access to essential medicines, financing, and leadership or governance. All of this need to be strengthened together, actually. And back in the day at the COVID-19 pandemic, we also learned about what we call the uh, like technology advancements.
Mm-hmm.
Before that, we barely known about Zoom meetings,
Mm-hmm.
Microsoft
Yeah.
Teams, Google Meet, and
Mm-hmm.
etc. Right now, we are so familiar
Mm-hmm.
with that kind of meeting. So I think COVID-19 pandemic bring back bad impacts and also good impacts in us.
Mm-hmm.
Yeah.
Also, how did the program address the challenge of vaccine hesitancy?
Yeah, it was a fascinating topic. Yeah, I actually had a child that also involved in immunization program by
Mm-hmm.
the government, and also I provide I try to provide immunization for my child besides the government program.
Mm-hmm.
So a lot of Indonesians face vaccine hesitancy
Mm-hmm.
or immunization hesitancy. It is the belief that vaccine may be unnecessary,
Mm-hmm.
ineffective,
Yeah.
or unsafe, or leading to reluctance or refusal to vaccinate.
Yeah.
It was affected by a lot of aspect like religion aspect and etc.
Mm-hmm.
Mm.
Yeah, Indonesia, the biggest affection for vaccine hesitancies from religious
Yeah.
aspect actually.
Yeah.
WHO named it one of the top 10 threats of the global health in 2019.
Mm-hmm.
Uh, a lot of housewife, a lot of mothers actually don't understand that vaccine is really important in Indonesia
Mm-hmm.
because some of my neighbors believe that yeah, vaccine is unnecessary. It's just a program to control you,
Mm-hmm.
or sometimes it is haram because
Oh.
it contain what kind of
Ingredients.
yeah, pig ingredients from pig. Yeah,
Mm-hmm.
uh, but they didn't understand. But we already made some made some what is that uh made some okay made
Formulation.
no made the immunization become safe to us
Uh-huh.
actually. Sorry. uh
It's
the
okay.
vaccine hesitancy, yeah, sometimes for the mothers, they believe that oh my children is okay
Mm-hmm.
without vaccines,
Mm-hmm.
but they didn't realize that he is okay or she is okay
Mm-hmm.
because he or she is around the children who has been vaccinated.
Yeah.
So they become a more safe environment,
Mm-hmm.
like COVID-19. When we are around uh, the people who got fully vaccinated,
Mm-hmm.
we become safe
Mm-hmm.
without vaccination.
Yeah.
So but that's really wrong beliefs, I
Mm-hmm.
think. So we learned that addressing vaccine hesitancy actually requires in a public health approach,
Mm-hmm.
building trust and using is framework, making vaccination is easy, attractive, social, and also timely,
Mm-hmm.
and also engaging communities as partners. We should make some collaboration with some villagers, with some head of the village,
Mm-hmm.
not just recipients of on information. The key is to make a healthy choice the easy choice.
Mm. All right. So next, I really want to know about like how can what you've learned be applied to improve health system in Indonesia?
Yeah, there are several key takeaways I plan to bring back. Number one is strengthening primary health care. We got puskesmas, we got primary clinic, yeah, we got also posyandu community service. WHO actually recommends reorienting health system toward primary health care as the foundation of universal health coverage or UHC. UHC means cakupan semesta. Yeah,
Mm-hmm.
Mm.
we bring that terminology back in the day with BPJS Kesehatan.
Mm-hmm.
Actually, we need to shift from hospital centric acute care to community based prevention and also health promotion. And then, secondly, we also address social determinants of health. Health is shaped by factors like housing. Uh, we need to make some safe housing materials like the roof, so we prevent from the heat wave, heat stroke, and etc.
Mhm.
And also the the safe building materials like the walls also. And then education and also employment. Building health programs must address these upstream determinants, not just treat disease downstream, and also build health workforce capacity. One of the way to build health workforce capacity is by this course and also the other course, online or offline. There's a global shortage of health workers
Mm-hmm.
around the world,
Mm-hmm.
not only in Indonesia, but also around the world, in Japan also. Made it worse by the pandemics. We
Mm-hmm.
need to support and retain our current workforce. Like you will be the future workforce. Invest in training and also create robust talent pipelines. Yeah. And then the fourth things that we should take care of is leverage technology and data.
Mm-hmm.
We also should pay attention with digital health tools.
Mm-hmm.
We also make a wise usage of AI and also robust health information systems.
Mm-hmm.
It can improve disease surveillance, program evaluation, and also decision making.
Mm-hmm.
Actually, for AI, we haven't had a particular law regulating AI, but we should use AI wisely uh, because it could be beneficial to us and also. But if we make too dependent with AI, it will be make our brain work slowly than the usual
Mm-hmm.
people that haven't used AI a lot. And then the last but not least, strengthen community action. Community engagement is not optional. Actually, it is essential for the health movement. Programs designed with communities, not just for them, are more effective and sustainable. That's why you should learn about health promotion and also how to communicate with the communities. For nurse also, it's really important to be a community nurse. Yeah, we got a lot of uh, research about how to maintain a good community for facing the recent health problems nowadays. And for you, for which department? Nutrition?
Yep.
Yeah, nutrition also. We the main priority is MBG ya. We should MBG ya, makan bergizi gratis ya. Nah, we should strengthen our relations to the community. We
Mm-hmm.
should empower them how
Mm-hmm.
to create a good nutrition lunch for the kids. Yeah.
Mm-hmm.
I think that's a good idea, but we need to implement them uh, more wisely, more better than nowadays.
Yep,
I think about that.
that sounds incredible. Pak Rizky,
Yeah.
I believe that there are many students or maybe young health professional who might still hesitate to step into international opportunities like you. Could you please share your messages or motivation for them so that they could feel maybe more confident to step into opportunity in international region like you?
Yeah. Uh, that's a good question to Aurin. Uh, my message is simple: invest in yourself and invest in your community.
Mm-hmm.
How to invest in yourself? You should learn a lot how to use English to join international communities, and also you should learn a lot. You should read a lot of English literacies
Mm-hmm.
to be more confident
Mm-hmm.
to involve in international communities. And public health is not just for doctors
Mm-hmm.
and for nurses.
Mm-hmm.
It is for everyone, for nutritionists
Yep.
who cares about making society healthier.
Yep.
Look for opportunities to learn, look for the network, and grow, whether through scholarships, online courses, or maybe you can join community projects. Yeah, become a volunteers also.
Mm-hmm.
And remember, a leadership in every sectors and also in public health is about enabling, mediating, about what society needs and how can we uh, fulfill their needs, and also advocating the public health. As the Ottawa Charter says, health promotion is the process of enabling people to increase control and improve their health.
All
Good
right.
question.
It's simple, students. Invest in yourself and invest in
Mhm.
your
Yeah.
community. Next, sir, we have some questions from us. Maybe I want to talk about like how can students apply for a similar scholarship?
Yeah, great question. We got a lot of announcement from a lot of institutions. Yeah, we got a lot of announcement from Ministry of Health, another ministry too, Ministry of Foreign Affairs. Uh, that will become official scholarships.
Mm-hmm.
And keep an eye from the online website from different countries. For example, from me is from New Zealand government.
Mm-hmm.
I also applied for some scholarships too for the courses, short courses, from the Korean governments and also from the Chinese governments. Uh, but for these scholarships are open to health professionals from Asian countries. So
Mm-hmm.
be uh, for the other scholarship like for the volunteering programs, I also got some information from my partners. So I usually share the information for the scholarship, for the volunteering programs through the Eclipse members,
Mm-hmm.
Mhm.
and also through the partnership communities in Poltekkes Kemenkes Yogyakarta, and also through Mrs. Eko too. And the application process typically involves submitting a curriculum vitae, motivation letters,
Mhm.
your TOEFL score
Mm-hmm.
Mhm.
or IELTS scores,
Yep.
and then recommendation from the campus or your institution.
Mm.
I think that's all.
Okay, that sounds very interesting. What do you think the most important skills for a career in public health?
Yeah, the most important skills in a career, not only in the public health sectors.
Mm-hmm.
It's how we made a critical thinking,
Mm-hmm.
always questioning everything. It made us improve ourselves, and we can make some research about it. And then communications, we should be able to communicate well to our team members, to our colleagues, to our partners to become successful.
Mm-hmm.
A lot of Indonesian people actually very intelligent people,
Mm-hmm.
but some of intelligent people fail to make good communication skills.
Mm-hmm.
It's better when you have average intelligence, but high communication skills. It would be more practical and more good solutions for you to be in the work field and also to work in teams. And also data literacy. We should make some decisions based on data, not only based our emotion,
Mhm.
not
Yeah.
only based our experience, because many people can get a different experience and point of view. So we should make our decisions by the data, and also the ability to work in teams. Maybe in schools we are learned to compete with others, to make some competitions, to be the champions. But in work field it's different. We should be able to make a cooperation, make a partnership, to be able to make some work with our teams. uh, it is also based on a good communication, and also we should have some empathy to our team. Public health is interdisciplinary. You will collaborate with epidemiologists,
Mm-hmm.
economists, some health law practitioners, some doctors, communicators, nutritionists,
Yep.
nurse, uh, IT specialists, and community leaders. And don't underestimate the soft skills that you learn
Mm-hmm.
back in your school, like empathy and also cultural sensitivity. They are essential for building trust with communities, both local communities and also international communities. And that's essential skills that you should master in here.
Mm-hmm.
All right, so we have one last question for you, sir. The question is, what is one book or resources you recommended for us?
Yeah, not only one book or resources, but I will recommend two. Uh, Back in the course, I got one good resources from WHO about WHO evidence informed decision making guides.
Mm.
It is a comprehensive framework for using evidence to improve health outcomes, to make a good decision making
Mm-hmm.
in the future. And also the course materials from the University of Auckland, from the learning management system Canvas, are excellent and freely available on many topics. Besides that, for the self-development, I recommend you my personal favorite is a
Mm-hmm.
grit book. GRIT. Grit. Grit
Mm-hmm.
is persistence on pursuing our goals, our dreams. uh, it's about uh, it's about how we maintain our spirit to pursue our dream, whether in we fail, whether we succeed,
Mm-hmm.
and how we should maintain our discipline to purchase, to pursuing our dream.
Mm-hmm.
And that's the essential skills for the future in us.
Okay, that's a good recommendation. But I guess that will close our sharing session for today's episode. Thank you so much, Mr. Rizky, for sharing your incredible journey and insight. This has been truly inspiring.
Yes, thank you very much for having me, Aurin, and also Intias. It's been a pleasure to share what I've learned, and I hope this encourages more young Indonesians like you too, and also the other peoples from Indonesia to pursue the opportunities in global public health and also the scholarship everywhere.
Yeah, all right. And to all our healthies listening today, remember, public health is about more than fighting disease. It's about creating the conditions for everyone to live healthy, fulfilling life. As we learned today, the first one, health, is the resources for everyday life, not just the absence of disease. The second one is equity, means giving everyone the tools they need to succeed, not just equal treatment. The third one is community action and empowerment are at the heart of health promotion. And we hope you feel inspired to learn, connected, and contribute to public health in your own communities.
Until next time, healthies, stay curious, stay healthy, and keep making a difference. See
See
you
you on
on
the
the
next
next sparkling
sparkling
episode.
episode.
Goodbye.
Goodbye.
Goodbye. See you on the next sparkling episode.